Today, we will review the nursing responsibilities for blood transfusion according to AABB standards using our new electronic system. First, before starting any procedure, the nurse should ensure that there is a valid physician order for blood transfusion entered in the electronic system. Without this order, the transfusion process cannot begin. Next, the nurse must confirm that the blood component reserved in the blood bank is available. Do not go to the blood bank unless the order is active and the blood is ready for collection. The assigned nurse, responsible for administering the blood, must ensure that .care is accessed using their own assigned nurse account. Before receiving the blood, the nurse should ensure that all essential documents are complete in the patient's file. This includes the blood transfusion consent, the initial vital signs documented manually, and the completed blood request form. At this stage, the nurse must also educate the patient about the blood transfusion process. Once the patient is educated and the documents are complete, the nurse must assess the baseline vital signs. These vital signs must be documented manually in the file. The nurse should confirm that the patient is stable and that no abnormal vital signs are present before going to the blood bank. Once the blood is received and delivered to the patient's room, an independent double check must be performed immediately by 2 qualified nurses. This includes verifying patient identification, blood compatibility, expiration date, and all required verification steps. After the double check is completed, the nurse will proceed to the electronic system. The nurse should open patient identification, enter the MRN, and then go to EMAR. The blood transfusion order will appear only if it is active and the blood has been received. The system will then guide the nurse through the preparation phase, which consists of 4 cycles. The primary nurse completes each cycle, and a second nurse counterchecks each one. This ensures full compliance with AABB safety standards. Once the preparation phase is completed, the system will allow the nurse to start the transfusion. During the first hour of transfusion, vital signs must be documented in the system at the required intervals. Before starting, at 15 minutes, at 30 minutes, and at 1 hour. If at any point the patient develops any signs of a transfusion reaction, the nurse must stop the transfusion immediately and review the case with the physician to confirm whether it is a transfusion reaction. Then the nurse must use the stop blood transfusion option in the system and follow the blood transfusion reaction policy. If the blood transfusion is completed without any signs of a reaction and the full amount has been administered, then choose completed transfusion in the system. Finally, the nurse must assess and document the vital signs after the transfusion to exclude any late reaction signs. This completes the AABB compliant process for blood transfusion using the new electronic system. All nurses must adhere strictly to these steps to ensure patient safety and compliance with accreditation standards.